Okay guys, it's Dr. Sexton again, and I'm here to talk to my patients out there and all my friends out in cyberspace about insomnia today. I see a lot of patients that come into me and ask me about these kinds of problems, and usually what they're looking for is a simple solution, a quick pill that's going to help them fall asleep. And so some of the medicines that they have out there that tend to be prescribed by doctors, usually the one that patients want more, are going to be in the category of, let's say, benzodiazepines, medicines that are related to things like Xanax and Valium. These are pretty good because they give you a sedation that makes you feel like you're about ready to fall asleep. They can last through the night and give people long-lasting sleep throughout the night without having to wake up several times. The problem with these is that they can be addictive, and if you stop taking them, your sleep is going to be even worse. And if you take them multiple times per day, there's a decent chance that you're going to get withdrawal symptoms whenever you're doing these for a long period of time. So I try and avoid these if people are going to be taking medicines on a regular basis. You'll see people asking for Ambien. And this is a little bit different medication that works without making you feel sedated. It actually just simply turns off your brain as you are trying to close your eyes and get a little bit of sleep. This too can be addictive though if you're taking it on a daily basis, and I recommend to my patients never to take this more than 4 days per week in order to avoid that kind of addiction. These are the strongest medicines that we have typically to give people relief from their insomnia. But then we have other half-hearted medicines, I might call them, because they tend to be less addictive. Patients tend to be a little bit more frustrated with these medicines because they can leave them feeling lethargic in the morning. They can be a little bit less sedating than the ones that I've mentioned up here. But again, if you were to take these every day, they will never give you withdrawal symptoms. And so they can be favorable in that regard. I'm not going to talk to you too much about those kinds of medications because what I want to talk to you about instead has more to do with the behavioral things that you personally can do in order to help yourself fall asleep on a regular basis. Sometimes you can use these techniques in combination with medications like Xanax or Klonopin or Valium, these sedatives that we have up there. But as you get better and better at your sleeping techniques, you're probably not going to need as much of the medication to go along with these behaviors. And so something that you should make sure and talk to your doctor about is if this insomnia has come out of the blue and you've started getting problems sleeping with no other reason that you can think of, there may be a medical problem that's causing this, and you should talk to them. They may do a physical exam and some blood tests that can figure out why this might be. But for our purposes today, we're simply going to talk about the sleep techniques that can help you out. So the first thing for us to think about is why is it that most people have difficulty sleeping? And the answer has to do largely with the stress that we feel in this day and age that we're living in. So we've got lots of responsibilities, whether it has to do with your obligations to work, your obligations to school, your obligations to your family. And these things can weigh on our minds a lot of the time whenever we're trying to get to sleep. And so what our goal is going to be is to get you to simply forget about some of those responsibilities as you're trying to fall asleep, and you can take up those thoughts again in the morning whenever you've actually got the time to deal with them. But what we need to do to get these off of your mind is sometimes we might use a medication like this to sort of sedate you and make it so that they're less prominent in your head, but we really have to get you thinking about things that are less calm. So one of the recommendations that I have for patients is that, let's say you've got a planned bedtime of 10 o'clock, 10:30, something that's going to give you enough time to wake up in the morning and have a good amount of sleep. It's different for everybody how much sleep they need, but you plan what time is right for you. 1/2 hour before you plan on falling asleep, what I'd like you to do is try and turn down the lights in your house to sort of a candlelight amount of light. Watch a TV show that's lighthearted, that's going to be relaxing, or if you decide to read, do it with a low level of light and get yourself in a relaxed mood as you do this kind of thing. I wouldn't recommend watching television shows that are going to get you more excited or get your mind thinking, trying to figure out who done it in a CSI type of a case. Let's watch something relaxing that you don't have to think about too actively. As you're watching this, you can watch it with your eyes halfway closed, and this will start your brain secreting a chemical called melatonin that tells your body that it's time to get to sleep, and this can help you get to sleep almost immediately whenever you decide to go up to bed. If you're watching this TV show with your eyes halfway closed, odds are you're going to nod off during this television show. But don't go straight up to bed. I want you to try and flirt with sleep for over half an hour, probably nodding in and out of sleep as you're watching this. And then whenever you finally go up to sleep, it's going to be much easier to get to sleep. But it's not only going to be easier to get to sleep during this night of sleep, but if you practice like this, flirting with sleep over and over on a daily basis, your brain is going to get so used to the sensation of waxing and waning in and out of sleep that you're going to be able to fall asleep much easier on future occasions. Give that a shot and see how it works. Okay, and so the last technique that I want to talk to you about happens more after you've gotten into the bed and you're ready to fall asleep. Now, you've done all of your planning for the day, and we don't need to think about any responsibilities. All you need to do is start relaxing. So what I want you to do is I want you to lay down in bed and just start thinking of the most relaxing place that you can, something of comfort. Maybe you think about yourself in front of a fireplace if it's during the winter. Maybe you think of yourself lying in a hammock with just a little rocking sensation. And this kind of pleasant sensation as you're thinking about it can be a very relaxing sensation as you go to bed and very easy to fall asleep to. Now, very often whenever people are nervous about the work that they're doing or other responsibilities that they have, their mind will deviate without them planning to the thoughts of responsibility. I might think to myself, oh shoot, I've got to remember to remind my nurse to do something in the morning. Well, okay, wait, that's a thought of responsibility, and that's going to be something that's going to occupy my mind. And one of the worst things that I can do is say, oh gosh, I can't think about this responsible thought. I've got to try and go to sleep and maybe try and stop this thought as quickly as possible. That's going to create sleep anxiety. That's going to make it so that I feel less able to get to sleep and all my hairs stand on end. Instead of thinking that I've got to get to sleep right now, I'm going to try and relax. I'm simply, instead of fighting that thought of responsibility, I'm going to try and deviate away from it. I'm going to think, you know what? Yes, I can take care of that responsibility and tell my nurse to help me in the morning. But what I'm going to do now is I'm going to think about how about maybe having a barbecue with all of my nurses this summer coming over to my house. And this thought of responsibility turns over to a thought of relaxation and a guided thought of relaxation. Perhaps if all these nurses come over to my house and we walk down the street and we point out some of the views that we have from my house, maybe we'll look at other houses, maybe we'll look at the view down the hill. What's going to happen is that I am thinking of these relaxing thoughts and thinking of sights that I'm going to see along the way, and eventually as I am pointing these things out, my conscious mind that is thinking what houses are along this street is going to go to my unconscious mind, guided me seeing things that are maybe houses that are on my street, maybe houses that would never be found there, maybe even gingerbread houses that I might have seen whenever I was reading books as a youngster growing up. Well, as I start losing control of these thoughts and my subconscious brain is guiding these dreams, what's happened is I've gone from thoughts of responsibility to guided thoughts of relaxation to unguided thoughts of relaxation. These thoughts turn into daydreams, then turn into night dreams. You are falling asleep as this happens, and if you can just allow yourself to drift off into this, you're going to fall asleep doing this. These are merely some techniques that you can use to sort of relax your brain. Yes, we've got medications that can take the place of this. We've also got medications that can help you to relax as you use these techniques for the first time, but only you practicing them is going to make it so that you can get to sleep without them after you've gotten used to this. So I wish you luck on these techniques, and if we have other things to try, we can do those as well. Good luck.